How you doing? My name's John Tomasi. I'm be your student physical therapist today. So what we're doing today is I got 3 tests for you. And what we're going to do is we're going to test some of your cranial nerves. And each test will be a little bit different, but I'm just looking for anything that looks out of the ordinary or abnormal that's maybe something we got to take a little bit more look into, okay?
Okay.
So the first test we're going to do is just an eye test. So what we're going to do is we're going to test cranial nerve 3, 4, and 6.
Okay.
So what I want you to do is I just want you to stare at me, just nice and relaxed. Good, that looks good. I would be looking for any abnormalities in the sense of when she's resting, the eye deviates one way or the other compared so they're not symmetrical, or that eyelid's starting to droop down. So the next thing I'm going to do is I'm just going to have you follow my finger when you go. Okay, so just looking right at my finger here, and then just follow with both eyes. Here, all the way, good. All the way back. Good. Now we're going to go up. Good. Back down. Good. Now we go to the other side. Good. Up. And then back down. Well, that looks good there. So if I saw anything, it would be both those eyes, like one eye would not be able to follow my finger the whole entire time, and you would start to see that be asymmetrical. So the next test we're going to do is we're going to do a gag reflex test. So this is testing cranial nerves 9 and 10. So what I'm going to have you do is just have you open your mouth wide, stay nice and relaxed. And what I'm going to do is I'm just going to palpate that kind of tonsillar, that, the thing that hangs down in the back of your throat. Mm-hmm. So I'm just going to lightly touch it on each side, and I'm just going to see how it reacts. Okay? Is that okay? Here, just a little flashlight. I just want you to open your mouth nice and wide. Good. And then I'm just going to hit that spot. Boom. Good there. And then, you feeling okay? I'm going to do one more. That side there. Good. Okay. So that looked good. So it was normal. If I were to see something abnormal, it would be to only one side would elevate, but each side that I tested, it was able to elevate, and there were no deviations or one side that looked abnormal. Okay, so for the last test, what we're going to do is a tongue movement test. So same thing, I just want you to open your mouth. Okay. What we're testing is for cranial nerve 12. So right here, I'm just going to look at you. Just open your mouth. You don't have to do anything with your tongue. I just want to see how it sits in your mouth, okay? Okay. Just open wide if you can. Good, okay. And then what I want to have you do is I just want to have you open your mouth again and move your tongue side to side. Good, good. Does that feel okay? Yeah, so nothing there. Have you had any problems, speaking in general? Have you felt anything with your tongue, like voice sounds different at all? No. Okay, so that's something that could come up when we're looking at it. If we ask them and they said their voices changed, or people have heard them, kind of speak a little bit differently. With that one, if it starts to deviate, we would see that curling of the tongue, and it would just be onto that side that's weak. Okay. So you'd see like a little curl, like the tongue is like going this way. So that either comes from weakness, or we might have like an upper cervical issue that we may, like I said, if it was something abnormal, we may look into it more just to see if there's something we need to do outside of these tests. Okay. But overall, looks good. Everything looks good. Thank you very much for coming in.
Thank you.
Appreciate it.